Members, it's 10:40 and we've got enough members, so let's resume. So this is item 5 on our agenda, an overview of medical and dental benefits for civil servants, pensioners and eligible dependents. We have a total of 9 deputations, and so on behalf of the PS panel, I would like to welcome the deputations and the officials for attending our meeting. So, if necessary, you can wear the earpiece and choose the right channel. Floor 0 is the channel 0 is the floor channel, and then channel 1 Cantonese, channel 2 English. So I'll invite the deputations to address the panel one by one. Each deputation will have 4 minutes. Now, some of you have already given us your submissions. In fact, the submissions have been uploaded onto our website, so there is no need for you to read out your submissions again. Please only highlight the salient points in the submissions, and please bear in mind that what you say at this meeting will not be covered by the Electoral Powers and Privileges Ordinance. And please, when you speak, do not try to refrain from speaking in cocktail language to facilitate the work of the interpreters. First of all, we have Mr. Chung Taek-chung, Vice Chairman of the Hong Kong Civil Servants General Union. Chairman, 5 years ago, we attended a panel meeting and we spoke on the same subject. At the meeting, civil servants voiced their views and their requests, but no improvements have been made since 5 years ago. What improvements have we seen in terms of medical and dental benefits for civil servants and eligible persons? Why is it that we are still so discontented? Why is it that we are still so angry? Now, we've been told that consultation rooms and dental surgeries have been increased over the years. So, can the administration give us a comparison with regard to the figures in 1997, 2004, and this year? We do not want to see to have the number of rooms, the number of chairs. We want to have the number of manned rooms. Now, there were 2 rounds of voluntary retirement schemes. Medical officers and dental officers, medical officers and dental officers left the civil service, and as a result, many of the consultation rooms have remained vacant. We want to know when the level of service for civil servants can be fully restored. Now, 17 years have left since the reunification. We are not trying to compare the present situation with the situation in the colonial days. Previously, we could have a dental appointment once every 8 to 9 months. There weren't too many complaints. And then concerning specialist service, we need to wait for years. This is really regrettable and saddening. I think the government, as our employer, should honor its promise. In the CSR, it is said that the best medical services should be provided to civil servants. It's difficult to define the best, but the best definitely doesn't mean common and ordinary or basic. Now, in fact, some civil servants, many civil servants feel that they have been let down by the government. Now, most civil servants are pensioners, and then they can still get medical benefits upon retirement. But then for newcomers, they do not they will not get any medical benefits upon retirement. So this policy is not humane. Now, in fact, people need medical protection most after retirement. According to the population report released by the government in 2012, we have an aging population, and medical services are very important for the retirees. And for civil servants on MPF terms, they are going to become the majority in the future. So we have two groups of civil servants with different retirement benefits, and I think this is a time bomb which is going to explode sooner or later. A government with a vision should review such a policy as practicable. The Hong Kong Civil Servants General Union would like to urge the government to review this policy, which is not humane at all. Now, Mrs. Ip, in fact, you did ask a question in the LegCo concerning funding for civil service medical and dental benefits, and the reply you got was that there would only be a lump sum given to the HA. Previously, the D of H provided medical services for civil service. Now it's the HA. We have no say. And in fact, we did not know that the service was taken over by the HA. In July 2011, there was the second public engagement exercise on healthcare reforms, and we were told that taking out healthcare insurance would be the way forward, but civil servants were not covered. So we'd like to know what medical benefits we should be entitled to. We are the employees of the government, but it seems that the relationship with the government is like that between the public and the government.
Next, Mr. Stephen Che from Government Employees Association. Well, for our association, we have several concerns about civil service medical benefits. First of all, the number of families clinics should be increased as soon as possible. Now they're in another places in Hong Kong Island. But how about Kowloon East, NT East, and NT Northwest? And for families clinics, now they are not providing enough services. So we hope that the policy agenda of 2014 can be implemented as soon as possible so that we can have more families clinic. And also we are very concerned about Chinese medicine service, and this is not included at the moment. Now for registered Chinese medicine practitioners, now they are recognized by the government. We hope that the government will come up with ways so that the Chinese medicine services under HA and DH can be included in the services provided to civil servants. And also when it comes to reimbursement of medical expenses, such as acupuncture or other specialist services, I hope all these can be included. And we are also very concerned about general outpatient services provided by the HA. Now, for civil servants and eligible persons, now they can go to public clinics and they can be put in special queues. However, for this kind of special arrangements, only incumbent civil servants can enjoy this kind of service. And for retired civil servants and eligible persons, they have to make appointments by telephone first. And if the quota is already filled, the retired civil servants and eligible persons cannot enjoy this kind of special service. So we hope that the government can provide enough special services places for retired civil servants and eligible persons. And the last point we would like to talk about is enhancing medical benefits for civil servants under new contracts. Now, for those who joined the civil service after June 2000, they cannot enjoy free medical services from the government. The government cannot drag its feet anymore. It's time for the government to review these employment conditions. In particular, when they retire, they should be able to enjoy medical services. This is very important for retaining talents in the government. Next, Hong Kong SAR Government Employees General Union. Mr. Kong Ming Chung. Thank you, Madam Chair. Now, with regard to building a new families clinic and enhancing dental services, as mentioned in the policy address, our union welcomes this. However, the government hasn't taken good care of retired civil servants and eligible persons. Now, many civil servants have working under huge pressure, so they may not be of optimum health. And when they retire, they are not taken good care of. So it is not in line with the rules set out in the CSR, which is the best medical services will be provided to civil servants. Now, I can share with you two cases. One retired civil servant, because of stroke and kidney disease, is hospitalized, and when he was treated, we didn't know what his condition was, whether it's improving or deteriorating, but the HA hospital asked him to check to be discharged, and he has to seek a private sector treatment. It seems that he's dumped by the government, and his family really felt helpless. They dare not took the patient out, and eventually he died in Shatin. And another case is about a 54-year-old incumbent civil servant, because of stroke and other diseases, he's hospitalized. However, he's asked by the hospital to be discharged. He does not have family members, so nobody can take care of him after he's discharged. And also, he doesn't have the means to go to a private residential care home, so he's very depressed and he's helpless. So I've cited these two cases. I want to remind the government that in reality, there are people or there are civil servants that really need better medical services. I'm not talking about ordinary elderly home service. Now, for those who have acute diseases or serious diseases, they need treatment and rehabilitation services, but they cannot get any help. As for the second case I mentioned, the civil servant's not retired yet, but it's treated like this. So how can the government ask us to work with a reassured mind? And many civil servants have asked us this question, that is about Chinese medicine services. How come this is not included in the government's medical benefits? Now, the Chinese medicine service is not included, and the government has given us reasons, but we don't think that's justified. If you include Chinese medicine service, when it comes to serious diseases such as cancer, it can be very helpful. So I think there is an urgent need to include Chinese medicine service in civil service medical benefits. As for outpatient or specialist outpatient services, the coverage is not enough, and there are not many places. I hope that these places can be distributed in different districts so that civil servants do not have to go to another district to receive treatment, so that they can go back to the workpost as soon as possible. In accordance with Chapter 6 of the CSR, the best medical services should be provided to civil servants, and that must be done. Thank you, Mr. Kong. Next, Discipline Services Consultative Council staff side, Mr. Lee Kwan Kit. Thank you, Madam Chair. As for our Consultative Council, we cover the FSD, CSD, Foreign Service Department, Customs, etc. The government is responsible for providing the best healthcare services to the civil servants. This is clearly stated in the CSR. Now the government is not doing this, and the staff side of the Discipline Services Consultative Council is very dissatisfied. There are not enough places for civil servants in the queues for medical services, so we have to join the queues of the public, and the public may think that we are fighting for places with them. And also it is very difficult for us to make appointments. There are not enough staff and doctors in the clinics. And in particular, disciplined services staff would have to work on shifts. So when it comes to consultation time, there are a lot of difficulties. And when it comes to dental services, the average queuing time is very long. And there are not enough facilities for orthodontic treatments and not enough manpower. And also because of our shifts, we also encounter a lot of difficulties when it comes to making appointments for dental services. And I would like to talk about specialist clinics. Now there are newer facilities, and the waiting time for the first consultation is shortened. However, if we want to receive a comprehensive and thorough treatment, the queuing time is still very long. Therefore, many colleagues who are suffering from serious conditions, or because of this delay, their conditions would deteriorate. I have made those observations basing on statistics and experiences of our colleagues. If you want to know the detailed information, you can get it from our council. So on behalf of the staff side, I would like to make several points. First, for the medical and dental services provided to the civil servants, it is far below what is promised in the CSR. That is, the best services would be provided. And we discovered that the quality of service has been deteriorating. And what kind of measures does the government have to enhance the levels of medical benefits or services? Would there be more private, public-private partnership? And also, the government is injecting resources into the HA so that services can be provided to the civil servants. So where can we get these figures? And how can we analyze these figures? Thank you, Mr. Lee. The Junior Police Officers Association of the Hong Kong Police Force, Mr. Chen Shu-kun, the chairman. Members, secretary. Well, the government is the employer of civil servants, and in accordance with the CSR, it should provide the best medical services to us. However, the DH and the HA are the sole organizations providing such services to us, so that we are left with no other choice. There are not enough places for us, and only registration fees are exempted, and some of the drugs fees are exempted. Otherwise, the benefits we enjoy are the same as the general public. As for general outpatient clinics, there are not enough places for civil servants, and there are not enough time slots for us. In particular, for the civil servants that have to work on shifts, it's very difficult for them to get an appointment. And we also have to call the clinics to get a place. Otherwise, we cannot get a consultation. And for dental service, generally, we have to wait for 1 year. And if we want to undergo non-urgent dental operations, we have to wait for another 2 years. And sometimes we don't even have the chance to get a place to see the doctor. We have to call different outpatient clinics. As for specialist services, we have to line up for at least half a year. The government says that it will provide the best medical services to us, but it is only hot air. We are forced to go to the private sector. And the Chinese medicine service is not included in the civil service benefits, and we think we are deprived of such a right. The government has reiterated that the number of family clinics has increased. However, yes, the number of clinics has increased. However, there are not enough doctors. So you're just wasting money. The condition has not improved. We have tried to compare our benefits with the benefits of the private sector, and we try to find out whether the benefits we get are reasonable. Our conclusion is that for private sector employees, if they are sick, they can go to their company's panel doctors, and immediately they can get treatment. So basing on this conclusion, we think that our minimum medical benefits should be like this. That is, whenever we are ill, we should be able to enjoy the service of a panel doctor. It's not that we still have to get a place in the long queue, or we have to wait till we recover by ourselves.
The government provides a lump sum to the HA annually to provide medical services for civil servants, and the government has not told us how big this amount of lump sum is. We do not know whether this amount has been used by the HA effectively. We don't know whether the entire amount has been used on civil servants, and also members of the public get the misunderstanding that civil servants are competing with the public for limited HA services, and as a result there are more conflicts between civil servants and the public, and the image of civil servants among members of the public has been affected. We are of the view that there should be a separate account for services for civil servants. The HA should produce an annual report on the resources used for providing medical services to civil servants, so that we know that HA has used the resources effectively. The government has promised to provide the best medical services for civil servants, and please let me make it clear that we are not competing with the public for limited medical services and benefits. Thank you. Next we have Ms. Kin Wai from the Hong Kong Chinese Civil Servants Association. Yes, Chairman, I think the government has not dealt with one very important issue, and that is there is a severe shortage of medical and dental services provided to civil servants. The government is not able and has not been able to provide the best medical and dental service to civil servants. According to CSR 900 and also 902, the government will try to provide the best care and treatment to civil servants and their dependents. So we are of the view that we should have been provided with quality and efficient services. But then look at the family clinic service and dental services provided by the government. They are not enough to meet the civil service demands, and for orthodontic treatment the waiting time is as long as 2 years, and then specialist service and also diagnosis, the waiting time is extremely long, and as a result there is delay on the part of civil servants in getting treatment. Civil servants, like members of the public, have to use the telephone booking system to secure limited this at the general outpatient clinics. So the government must, as soon as possible, provide adequate medical services for civil servants. Third, the government has the responsibility to provide free and appropriate medical service to civil servants, and I think medical services for civil servants and medical services for the public should not be lumped together. The government is our employer; it has to discharge its responsibility and duty towards civil servants. Now, every year the government provides a lump sum to the HA, but then the HA doesn't provide a separate dedicated service for civil servants. We understand that last year a lump sum of $13 billion was allocated to the HA for the HA to carry out hospital redevelopment and improvement works in the coming decade. But then the government has not made sure that the HA can provide adequate and appropriate medical services to civil servants. And then NCSC staff should be entitled to free medical benefits. But then I want to point out that NCSC staff, even the full-time staff, even get the minimum provision under the employment ordinance with regard to medical benefits. In fact, we've said that they should be entitled to free medical service in public hospitals. But the government emphasizes that it is not prepared to change the existing policy. We are of the view that NCSC staff are also part of the civil service. The government, as a good employer, should provide basic free of charge medical service to NCSC staff. Next. In fact, we have on many occasions asked the government to progress with the times and to include Chinese medicine service as medical service for civil servants. And finally, I hope that the government can change its obsolete policies. It should provide adequate and appropriate medical benefits and dental benefits to civil servants. Thank you. All right, that's all. Thank you. Thank you very much. Thank you. And now we have Mr. Lam Kwok Ho, Chairman of the Government Discipline Services General Union. Thank you. Good morning, Chairman. Good morning, members. Good morning, Secretary. Now, first of all, I need to point out that our relationship with the Hong Kong SAR government is one between employees and our employer. So as my colleagues have pointed out, please do not mix government employees and members of the public together concerning medical services. People are criticizing civil servants for competing for limited benefits and services with the public. We are civil servants, and we're now speaking in our capacity as civil servants, not just as ordinary members of the public. I want to talk about outpatient service. Families clinics. We have families clinics. 5 years ago, we complained, and now we have one more families clinic only. So there will be one in Fan Leng. So only one families clinic was provided over a 5-year period, and these families clinics have all reached their capacity. For the Lei Mok Shu families clinic, at that time, few people used the clinic service, but now the clinic is very crowded. So we need more families clinics. And also, civil servants would like to receive Chinese medicine treatment. And it is stated in the paper that studies will be required, and there are already public Chinese medicine clinics in our HA hospitals. So can I ask the government to provide Chinese medicine service in our families clinics? Now, civil servants in the past were guinea pigs. Trials were or new proposals were tried on us. So why can't you provide medical Chinese medicine service in families clinics? And as some of my colleagues have pointed out, the queuing time for first appointment for specialist service is as long as 2 years. Previously, there was a separate quota for civil servants. Now there isn't such a quota, so you wait for 2 years, or if you don't want to wait, if you can't afford to wait, you go to see a specialist in the private sector. And we can't jump the queue. And if then if we are allowed to get some priority, people will criticize us for competing for benefits with the general public. And then, we're going to reach the retirement peak period very soon. And my colleagues have already pointed out that before we retire, this CSB pays for our medical bills. But then if after I retire and I have a stroke and I'm in a CNA home, then I will come under the SWD queue, not the civil servants queue. So after retirement, we are just like ordinary members of the public. So in fact, after retirement, the medical benefits we get are no different from those enjoyed by members of the public at large. And so improvement is badly required. Thank you, Mr. Lam. We now have Ms. Lee Wai-yi, Chairman of the Model Scale 1 Staff Consultative Council. Thank you, Chairman. Thank you, electrical members. I attend this public hearing on behalf of the Mod Scale 1 Staff Consultative Council. We have 3 suggestions. Firstly, now for those who joined the government after the year after June 2000, they hope to be able to continue to enjoy medical benefits after retirement. For this group of civil servants, when they retire, they can't get pension benefits, they can't get medical benefits. But in fact, medical benefits are more important to those who are getting old. They don't have any pension benefits. They can get their MPF benefits only when they reach the age of 65. And they are denied medical benefits by the government, and so they are really worried about their retirement life, especially the first few years after retirement. Now, these civil servants have served the Hong Kong government for a long time, and they really hope to be able to enjoy basic medical benefits upon retirement. And then we are of the view that medical services for civil servants and medical services offered to general members of the public should be separated. When civil servants seek treatment at HA hospitals, members of the public criticize us for competing with them. They claim that civil servants get special privileges and priority. So there is this very deep-rooted understanding on the part of the general public. Our employer has promised to provide medical benefits for us. We're not trying to compete for resources with the general public, but then the general public have a lot of confusion and misunderstanding. We no longer want the public to have this wrong impression. And we are of the view that services to the public and services to the civil servants should be separated. And there should be more families clinics. Members of the public know very well that families clinics are for civil servants and eligible persons only. Concerning specialist service for civil servants, the service is not adequate. But I understand that the 9H specialist service has been launched. This is good, and also there is a specialist clinic and an imaging center for civil servants at QEH. Members of the public know very well that these are for civil servants only. So we don't want the public to feel that civil servants are always competing for limited service and benefits with them. And I hope that the Civil Service Bureau can provide better medical service for civil servants. During the British colonial era, there was a military hospital. We are civil servants, and many of our colleagues have said that as there are so many civil servants and eligible persons, then the government should consider constructing a hospital for civil servants.
Next, the Alliance for Civil Service Medical and Dental Benefits. Dr. Yuen Kwok Wah. For civil service medical benefits, they are one of the employment conditions for the civil servants. So this is not exactly a benefit. Now, we are on the receiving side, and for many years, we have been saying this, that is now for the service provided by the government is a far cry from that promise in the CSR. Lately, the government has made some minor improvements to certain services. However, for general, specialist, outpatient service, dental services, hospitalization services, etc., there is still a huge room for improvement. As for elderly service and Chinese medicine service, as well as medical services for new recruits, the government has been brushing them aside. I would like to make use of this opportunity to talk more about the problems concerning dental services. Now, the queuing time has always been criticized, in particular when it comes to specialist dental services, other than children's services. In 2012, when it's compared with 2010, the queuing time has increased significantly. As for orthodontic service, when you would normally have to wait for 4 to 5 years before to get the service. As for putting on braces, now the best age for doing that is 12 or 14, but then now the children can only get service at 16 or 17, and the service period would last for 2 years. So for many children of civil servants, because they cannot complete the service before the age of 21, they are deprived of such a right. Now, for this long waiting time, who is going to suffer from it? The civil servants, but not the creator of these problems, that is the government. Is that fair? Now, many dentists have chosen to leave, and for those who fill up their posts, many of them are not qualified specialists. So now non-specialists are providing specialist services. For this kind of arrangement, it will have a direct impact on the quality of service. This goes against the principle of best medical services, and medically it is unacceptable. So we can see that for the DH service, dental services, definitely they are not up to the par as promised in the CSR. Now, in 2010, there was a CSP scoping study. There was a proposal there that is private doctors should be asked to help. Now, from 1981 to 1983, there was this arrangement that is private doctors, or some of the services were outsourced to private doctors. By doing so, you can more effectively use the service of private dentists, and the dental service problem that has been existing for such a long time can be resolved. Thank you. Now there are several members who would like to ask questions. Kwok Wai Kang, me, Pun Xiu Ping, Lee Chak Yan, Emily Lau, Leung Chi Chung, Tony Jie. Any other? Secretary, any response? Later on, each member will get 5 minutes. I would like to thank the deputations or colleagues for coming here to express their concerns. I totally understand. And I would like to explain on several points. First of all, with regard to the government's commitment. Now, according to the contract, the government will provide the best or free service, medical and dental services to civil servants and eligible persons through HA and DH. As for the nature, level, and scope of services, this would have to be decided by the actual situation and the doctor. Now, as for HA, previously, it was the medical services department. And we have to be very prudent when it comes to providing resources to DH and HA. Through DH and HA, we hope that we can provide appropriate services. In the past few years, we have made some improvements. For example, dental services has increased by 32% from 169 to 224. And also, some other members mentioned that now there are specialist clinics set up. As for the reimbursement of medical expenses, there has been an increase of 25%. That is compared with 2 to 3 years ago. Now we will continue to work in this direction and to provide more services. As for the services to be provided in 2014 and 15, they are outlined in the paper. I'm not going to repeat them. As for Chinese medicine service, I understand your concerns, but you have to know that this is basically not the standard services provided by the HA and DH. As for HA, even its staff cannot enjoy Chinese medicine service. But of course, we will monitor the Food and Health Bureau's possible setup of a Chinese medicine hospital, and we may make changes after consideration. As for the new recruits after 2000, when they retire, they will not be able to enjoy medical service. Well, a few years ago, there were detailed discussions concerning this. We have also made reference to the arrangements in the private sector. We have also conducted broad consultations, and this is in line with the present market situation. So we do not have any plan to revise this arrangement. So when these civil servants were recruited, they already knew that. But we will continue to put more resources into the public healthcare sector, and civil servants as members of the public as well, they can also benefit. As for general outpatient clinics and the queues, well, there are special places reserved for civil servants so that they can go back to their jobs as early as possible. Well, not all these places are used up at the moment, so we will continue to monitor the situation. As for HA's figures, now HA basically provide comprehensive services. So for civil servants or eligible persons, when they go to HA hospitals, they will be able to enjoy all sorts of services. But of course, there are some specialist services for civil servants. But as you know, it is impossible for the HA to provide a comprehensive set of services for civil servants exclusively. The HA will look at its services on a whole. But if it is to be carved out, then the amount of money, in theory, cannot be plowed back into the other parts of its coffers. So this is not a very practical arrangement. As for public medical service and the service received by the civil servants and eligible persons, yes, I agree that they are not the same. For civil servants and eligible persons, well, they can enjoy services that cannot be enjoyed by the public. For example, dental service and drugs. They can enjoy more types of free drugs. So this is we as an employer is doing. So we are using public money. So we really have to consider how public resources are used. So now there are tens of thousands of civil servants and eligible persons. So we really have to be prudent. This, of course, should not be compared with public medical services. However, we're still talking about public money, so we really have to be very careful. As for care services, they are not provided by the HA and DH. We are talking about medical services right now. And for care services, the government would provide resources through other channels. As members of the public, of course, you are all entitled to care services. Thank you. Mr. Kwok Wai-keung. Thank you, Chairman. Well, first of all, I would like to thank the representatives of the civil service unions. I hope the Secretary can answer some questions in details. First, about dental service. Now, the Secretary said that the number of places has already increased for dental service. However, the representatives told us that the waiting time is still very long. So can the Secretary tell us more? And now you have increased the number of clinics. How will it help in shortening the waiting time? A second question is, for NCSC staff, they are like and will have nots. They cannot enjoy promotion or pay increase and no fringe benefits. And you are saying that their remunerations cover all. That is not true, because they do not enjoy a particularly high pay. So even if they are if they are freelancers, they should enjoy higher pays, but that's not the case. So shouldn't they enjoy the same medical benefits as other civil servants? That would be more reasonable. And the third question is about Chinese medicine service. Now these Chinese medicine practitioners are registered doctors, and they are under a system, and there are university programs teaching Chinese medicine. It's just that the HA and the DH do not want to include it as a formal service. There is no reason for the government to do so, because Chinese medicine practitioners are registered doctors, and they can issue doctors' letters, and also there are university programs. And how come you are saying that this cannot be a standard service? Well, because for treating cancer, Chinese medicine has alternative methods so as to relieve pain for the patients. So how come you don't do this for the patients? And also for retired civil servants, in particular for the new recruits after the year 2000, they cannot enjoy pension after their retirement. They are in a different retirement system. Medical service is very important in their retired life. So I hope the government can provide medical services to these group of retired civil servants. Now the civil servants do not enjoy particularly high pay, and the new recruits have no pensions, and now you even take the medical benefits away from them. So how can you attract talents to join the civil service? Who wants to be so stupid? Secretary, there are several points. First of all, about NCSC, they are not and have not. They enjoy pay rises. So we have been talking about this issue, and most of the jobs are not long-term jobs. If the posts are long-term, then their post will become permanent. So it is very difficult to compare such posts directly with civil service posts. As for dental service, now the average waiting time is 12 months. And after enhancing the service, well, there will be more dental surgeries, and I'm sure there will be improvements. But as to exactly how much waiting time can be cut, we have to look at the actual situation. All Hong Kong and most of the Kowloon dental clinics will just have a waiting time of 12 months. And for new cases, they can get to see the dentist in 6 months. Well, we understand your aspiration, and we will try our best to improve the services.
And concerning orthodontic service, I think as members are aware, of course, we need to consider the resource implications, and what's more, there really aren't enough orthodontists in Hong Kong. But then the DOH has been trying to resolve this manpower shortage problem by sending staff to training courses, and then there are also non-full-time orthodontists hired by the DOH. And I want to say that we need to bear in mind what services are the standard services provided by the DOH and the Hospital Authority. And then concerning the government employees joining after June 2000, we have taken into account all the arrangements, pay, benefits, and so on and so forth. And we don't think the change in policy in June 2000 has affected people's interest in joining the civil service. Yes, Secretary, I want to ask a question about resources. Now, previously, medical services were provided by the Medical and Health Department to civil servants, but then upon the setting up of the HA, the service was taken over by the HA. But then, as you know, civil servants need medical services like the general public too. And is there an estimate concerning the amount of resources required by civil servants? Now, Chairman, it's difficult to come up with such an estimate. Now, say, for example, there is an operation theater in a hospital, and it serves members of the public as well as civil servants. And civil servants and eligible persons may be able to get the drugs free of charge, while members of the public will have to pay for the drugs. So we do have some figures concerning dedicated services for civil servants. For example, the specialist clinic for civil servants. But I want to say that concerning the lump sum provided to the HA, the HA needs to provide medical service for civil servants, but then it's difficult to quantify how much time the medical personnel used on civil servants. And also, it is not that civil servants will not be taking up resources for the general public. Now, Secretary, in the past, when I was a civil servant, when I and my dependents went to seek treatment, we needed to produce a GF-181. Is this still necessary? No, because everything has been computerized. Civil servants and eligible persons only need to show their ID cards. But then the clinics know whether the patients are civil servants and dependents or not, right? So can we ask the HA to start collecting data? For example, those who can get reimbursement, those covered by the direct payment arrangement. So can we start collecting data? Yes, yes, we do have figures concerning reimbursement, direct payment, but now, the difficulty is this. Now, the clinics know how many civil servants and eligible persons have visited the clinics, but then it's quite difficult for them to come up with figures concerning the amount of resources used on civil servants. For example, say if a civil servant is hospitalized, and there is one civil servant in the entire ward, then how much time does the nurse spend on the civil servant, and how much time on the rest of the patients in the ward? But then it's not difficult because I believe you have unit costs. For example, operation theaters, what services. I believe civil servants as well as members of the public want to know. But I think there will be difficulty. I don't think having such data is really meaningful. And then concerning Chinese medicine service, now I believe you are of the view that the scope is too wide. So maybe first of all you can set a reimbursement ceiling, and second you can just provide certain types of service first. For example, acupuncture. Yes, thank you. Thank you, Chairman. Now, I want to say that the Chinese medicine clinics in HA hospitals are not operated by the HA. They are operated by NGOs, and even HA staff need to pay for the service. Now, we are not ruling out the possibility of including Chinese medicine service in the medical benefits for civil servants. But we understand that Chinese medicine is still developing in the public sector, the public medical sector. So we have to monitor the situation. Mr. Lee Chuk-yan. Now, so the unions are asking this question. What's the difference between civil servants and members of the public as far as medical services are concerned? I really don't know what benefits or services CSB is providing to members of the public. All right, is it that you will tell me members of the public need to pay $100 for 1-day hospital service, and civil servants need not pay? So, as an employer, what medical services are you providing to your employees? And so you're responsible for the $100 a day, all right, for hospital for hospital service, and then drugs. Yes, for drugs outside the formulary, there is the amount, and then for drugs in the formulary, so you pay $10, right? So ultimately, we're talking about $100 a day for hospital service and drugs outside the drug formulary. That's all, and then dental services. As civil service have pointed out, sometimes they have to queue up for a few years. So why can't you resolve this problem through medical insurance? Secretary, you said that it was quite difficult to calculate the amount spent on civil service concerning medical benefits, $100 a day. But then that's the fee, that's not the cost, correct? Because the cost has to be borne by everybody. And so so you're only paying $100 a day for civil servants if they're hospitalized, that's all. Yes, allow me to go into some detail, Chairman, concerning the difference between the general public and civil servants. Now, consultations and drugs free of charge, and then hospital charges. First class ward, $350 a day, but for the general public, $5,600. And then general service, we have 73 providing free general service, and then 65 provide priority this for civil servants, and then specialist service, 48 specialist clinics. But civil servants still need to queue up, and then the family's clinic service, of course. These are exclusively for civil servants and eligible persons. And then dental services for civil servants. The level of service is much better than the level of service provided to the general public. And then reimbursement of fees and charges. Now, if the HA doctor or the DOH doctor can prove that the civil servant needs a drug that's outside the drug formulary, there will be a reimbursement. So I've already mentioned that, all right? Drugs outside the formulary, but and then queuing, all right? Some better treatment, but then concerning specialist service, yes, I understand that there are one or two specialist clinics for civil servants, but that's very limited. So as an employer, you are providing very limited medical benefits to your staff, to your employees. I understand that civil servants need to queue up like members of the public for specialist service, and then for the families clinics, you have to pay the HA or the DOH for the service. So can you try to provide a better service to civil servants through medical insurance, for example, dental service? Can you, instead of providing piecemeal improvements, resolve the problem once and for all through medical insurance? Chairman, I do not agree that we are providing minimum service to our employees. Now, in particular, for dental services, we are providing much higher level of service than that offered to civil servants. And also, when we provide that medical services to civil servants and dependents, we're using public funds, so we have to be careful in using public funds. And then, concerning allowing civil servants to see non-public sector dentists, the cost implication was very substantial, and we decided that that was not the preferred approach. So we'll continue to enhance our specialist service and our dental services, and for every year there are enhancements and improvements. I will not go into the details. And then medical insurance. We need to look at the Food and Health Bureau's study. We have to consider the long-term development and whether we need to work out certain arrangements for civil servants. Ms. Emily Lau. Thank you, Chairman. I thank the deputations for coming today. We do understand that civil servants they are not in a good mood. They do not feel good. In fact, we understand the civil servants now work under immense pressure because of increasing complaints from the public. And I also said that Mr. Michael C. Has recently said that corruption may increase with the scrapping of pension arrangements for civil servants. And the secretary did give an explanation under the last discussion item. He said that in fact civil servants could get their pension benefits or MPF benefits at the age of 60. But it seemed that Mr. Michael C. mentioned the age of 65. So we want this point to be clarified again. And the deputations said many times that the public felt the civil servants were competing with the public for limited medical services and benefits. Now, I think the public, on the whole, are of the view that the SAR government provides very good employment terms for civil servants, and I think it's good because if the salaries offered to civil servants are attractive, they will be less prone to being corrupt. And some members of the public also want to join the civil service. But why are they complaining? This is because the public do not get dental service, and the public say have to wait for 3 years before they can have operations in the hospital. But then the deputations are telling us that here we're talking about terms of employment, civil service benefits, not just services for the general public. Now, in fact, in May this year, the UN Committee on the ICSCR will be holding a public hearing. So we're talking about cultural, economic, and social rights of the people. Now, civil servants should not get privileges. In fact, they are also members of the public. Now, you said that the government promised to give you adequate care and the best care in a timely manner. But then we are concerned about the public as well as the civil servants, and there are these conflicts. I think the Secretary understands this very well.
So this is your bureau's responsibility. Now that the civil service unions are telling you so many problems, they are very dissatisfied. So can you tell us more? Or do you want to wait for an overhaul of services in the government? Now, how can you explain to the public? Now, there are people listening to these meetings. Some of them are civil servants, some of them are not. Both parties are very unhappy with the shortage of healthcare services. So how are you going to handle this problem, Secretary? So there are several points that I would like to address. First of all, about civil service medical benefits as well as other employment terms. Well, we want to provide a reasonable and attractive package to attract talents to join the civil service. This is our goal. But I have to say that we are using public money to provide benefits to the civil servants. So it has to be reasonable. We want to attract talents, but however, we cannot overspend. We cannot be overly generous. So with this goal in mind, we will continue to fight for resources so as to provide civil servants with good benefits. For example, dental service and specialist service. So each year we will increase the relevant resources, but there are always limits on resources. And also, when it comes to manpower, there are also difficulties. For example, for orthodontic dentists, we only have a handful of them in Hong Kong. The DH hopes that it can come up with solutions for this, so we will continue to fight. And on the whole, the government has undertaken that the overall medical services can be provided. Dr. Goh will give you more details in the future, but we will try our best to strike a balance. As for retirement, when a civil servant retires, now for the for the contributions that they made voluntarily, they can get the accrued benefits immediately. And when he reaches the age of 65, he can get the voluntary contribution part. Yes, we cannot be overly generous. We have to be fair. Yes, I understand that. And now, well, do you think that some civil servants are asking for too much now, so you cannot be overly generous? That's not what I mean. I'm saying that we will try our best to improve benefits for the civil service. However, we have to look at our resources, and there are some policy issues and structural issues. For example, Chinese medicine service, we have to work with the HA and the DH when it comes to the use of resources and the mode of service provision. Otherwise, things may go out of control, so we will have to be very careful. As for Chinese medicine service, we do not totally rule out the possibility of including it, but we will have to monitor the development of Chinese medicine. And when conditions are mature, we do not rule out the possibility of providing Chinese medicine service. Mr. Liang Chi-chang, I have heard the views of the civil service unions. They have their opinions well expressed, and some of them are very innovative. Some organizations suggest that maybe a hospital for civil servants should be established. Well, because they think that there is a shortage of medical benefits for them now, and it's not like in the past when civil servants went to public hospitals, they could receive better services. So they are very unhappy, and we hear a lot of grievances. Many members have asked questions, but the secretary has been adamant. You're saying that the resources must be used properly, and you have to wait for a time when the Chinese medicine service is more mature. Well, for this kind of answers, I think they are just old tunes, and there has not been any change. Then I'm sure the civil servants will become more and more aggrieved. The government must progress with the times. You cannot stick to the old ruts all the time. The secretary should gradually change his mindset. Otherwise, the civil service may continue to feel aggrieved. Now, after the year 2000, the employment terms of new civil servants have changed, and medical benefits have not progressed with the times. This is a problem. Some civil servants now think that because they have to wait for such a long time in the queue for medical services, so that's why they have to seek medical services in the private sector. And Mr. Li Chao-yan said that if that's not enough service, then maybe you should rely on insurance. When I read your paper, for reimbursement of medical expenses, it seems that it is a similar practice. So how do you make the calculations? So are you giving the money back to HA? Or some civil servants can claim medical expenses directly from you? I would like to understand more. That is paragraph 5 of the paper. You talked about reimbursement of medical expenses. And here we talk about $350 million in 2012 to 13. So was this sum given to public hospitals? That is, when a civil servant visits a public hospital, if extra cost is incurred, you will pay the hospital back. What sum is this? Now, you have asked several questions. I totally understand that colleagues would like to enjoy better medical services. That is a reasonable request. Well, we are also trying to make improvements gradually. I hope members of our staff can understand this, but as to whether this meets your wish, it may not be so. Well, for DH resources, in 2010 to 2009 to 2010, it was 600 million, and for 2013 to 2014, it's 1 billion. So you can see that's an increase, and it's about 9 to 10% annually. So it's not that we are not putting in extra resources, but you have to understand that when it comes to the overall resources, we are still subject to a lot of limitations. Resources have to be put elsewhere as well. So we are trying to make improvements in a gradual manner. And there are some fundamental problems, but we have to look long term. As for reimbursements and insurance, we have to wait for the overall medical insurance policy. And if we are for reimbursements, it includes medicines and equipment. For example, for drugs outside the formulary and for relatively expensive drugs, if an HA doctor prescribes such a type of drug to a civil servant, then a civil servant can get reimbursement for that drug, and that also includes equipment. And you can see that commitment in this regard has increased. Mr. Tony Chair. Thank you, Madam Chair, and I would like to also thank the deputations for attending today's meeting. The government is the employer, and it has its contractual obligations to provide medical benefits to civil servants. As a good employer, it should constantly review the quality of medical services it provides. And civil servants are also members of the public. They can also enjoy HA services. But of course, ordinary citizens also have the same rights. The Secretary said just now that for certain types of services, the civil servants can enjoy priorities. But there are problems as well, because this may affect the public, and they may not be happy. Now, you talked about general outpatient clinic. Well, paragraph 10 says that families clinic will be increased. So, Secretary, does the government have a direction? When it comes to general outpatient service, are you providing it through families clinic or other general clinics? Do you have a direction in this? And second, paragraph 12 of the paper outlined the improvement measures to be implemented in 2014 and 15, and under B, you say that the specialist dental service will be enhanced, and there will be oral, maxillofacial, and dental surgeries. The waiting time will be shortened. So do you have a goal here? How many places will be provided for the civil service? And also, in longer term, there will be more and more retired civil servants, and that will become a pressure. How are you going to tackle it? The number of families clinic will be increased by 15%. So should it not be increased to 25%? Have you done any projection in this area? Thank you. Several points here. First of all, about families clinic, there are two aspects. First of all, we will continue to monitor the need for service, and we will increase the number. But of course, there must be suitable sites and adequate manpower. Well, it is impossible to have as many families clinic as HA clinics, and for incumbent civil servants, because they may have to go back to work as soon as possible, so they may also receive services from HA clinics. So that's why there are priority places for them.
And then concerning para 12B, the waiting time is relatively long because civil servants as well as members of the public wait in the same queue. These are major dental operations. And we hope that the waiting time can be reduced from the existing 153 weeks to 66 weeks. Any more follow-up points? So is it that you'll be able to reduce the waiting time of 66 weeks within 2014-2015? Yes, that's our objective, Chairman. Next, Mr. Poon. Yes, thank you, Chairman. I thank civil servants for coming today to give their views. Now, in the policy address, a few remarks were made by the CE on civil servants. And I think the Secretary should really consider the following. First of all, the old system versus the new system. Now, it is true that the CSR says that civil servants were provided with the best treatment and the best service. But then I just want to say that for the newcomers in particular, you need to try to retain them. So the Bureau should consider or should review its existing policy in order not to dampen the morale of civil servants. Then on the dental, specialized dental service, it is said that the waiting time will be reduced to 66 weeks. Now, we understand in the health services panel that very often the constraint in the provision of dental and medical services is the shortage of staff. Secretary, you said that there could not be a separate account in HA with regard to resources for the provision of service to civil servants. But then can the Secretary make use of private medical insurance to resolve the problems that we face concerning medical and health services? Now, there are healthcare vouchers for the elderly, and so can the government think along similar lines with regard to medical and dental benefits for civil servants? Yes, Chairman, thank you. Yes, there is the old system and there is the new system. The cutoff point was the middle of the year 2000. Now we need to progress with the times. In fact, pension benefits are becoming obsolete, and we are not contemplating any change to our policy with regard to the newcomers, because any change will have far-reaching implications on our finances and also on the public healthcare sector. But of course, we we're concerned about whether this new policy will be an obstacle to us concerning the recruitment of staff and the retaining of staff. We'll continue to pay attention to the situation, but we haven't encountered problems so far because of this factor. Now, if the hospital authority and the DOH do contract out certain services to the private sector on a need basis, for example, cataract operations, civil servants can of course join those schemes. They will get reimbursements for such expenses. So basically, we provide the service through the HA and the Department of Health. But of course, they can consider what services to contract out. And we've set up the specialist clinic for civil servants. That's, in our view, is better than asking the HA to contract out the service. I understand that only on a limited basis there are PPP arrangements, and I will be studying the matter further with the Food and Health Bureau. Now, Mr. Kwok Wai Keung moved a motion, and the motion was seconded by our Deputy Chairman, Mr. Poon Shoo Ping. So we've got the wording here. So after we've dealt with all the questions from members, then we can proceed to deal with the motion. Now, perhaps the deputations can respond, because when the secretary spoke, some of them are deputations nodded their heads, some shook their heads, some even sighed. So perhaps we can give each deputation 1 or 2 minutes to respond. Now we have Leung Kwok Hong Tan Kapil for the first round, and then second round, I myself and Mr. Lee Chuk Yan. So after we've dealt with all the questions from members, then we will invite the deputations to respond. Mr. Leung Kwok Hong. Thank you, Chairman. So, Chairman, reforms were introduced in the year 2000 concerning the terms of employment for civil servants. Can I ask you how much savings you've achieved since then in terms of medical benefits to civil servants, and then overall speaking? So value for money, how much savings have you been able to achieve with the changes to the policy in the year 2000? Secretary, I don't have the information here, Chairman. At that time, we made reference to the situation in the private market. So you're telling us that in your view, there will be savings and there have been savings, but you can't tell us how much. So am I fair? But I want to say that we did not, our aim at that time was not to save money. But then for publicly funded service, we could not depart too much from the private sector. But the private sector purpose was to cut costs. So was it that you wanted to increase costs and as a result you decided to cut the benefits? So your officials say yes when it's yes, say no when it's no. When you talk about increased efficiency, then I think that should be measured in terms of money. So there is this policy, and you want to be closer to the private sector. The private sector wants to cut costs, and so I believe your objective was also to cut costs, but then you don't know how much cost has been saved. Secretary, in fact, our objective is not to cut costs, as this is only an arrangement for the workplace. All right, so what was your motive? So the motive was not to cut costs. So the motive was to fool civil servants around, right? I can still remember what Mr. Anthony Leung said. So can you, do I need to repeat for you what he said? So are you assuming that I have not read the policy papers? Now, concerning the consultation paper issued in March 1999, the purpose was to make the system more flexible in order to better respond to the aspirations of the community. So, Mr. Anthony Leung did talk about cutting costs. No, a lot of things happened in the year 2000. Please do not just mention one thing. I took part in the protest. 40,000 people took part in the protest. We marched from Victoria Park. So we have had 3 CEs since then, and we don't know what has happened to the person who advocated the change. And there was the policy objective. There is this policy objective. Why are you trying to follow the market practice? Do you want to attract more people into the civil service, or do you want to drive more people away from the civil service? Now, you were a civil servant and you are now a principal official, but you can return to the civil service. Have your terms been affected in any way? No, but do you know for a post like yours in the private sector, what is the salary? Now, Mrs. Yip has told us many times that, in fact, the salaries of our ministers are the highest among the world, except apart from Singapore. And you can return to the civil service. Now, let me ask Permanent Secretary this question. You are a civil servant. Now, the logic is simple. You want to follow the private sector. You want to suppress wages in order to achieve greater effectiveness, but then you are not able to measure the effectiveness. So it's really a waste of time talking to you, asking you this question. Now, Hong Kong keeps saying that it has to upgrade itself because it has to remain competitive, and you have to upgrade the civil service, and the officials keep saying that we have a problem with our manpower resources. Then what is your assessment of our civil servants? Now, all I can say, Chairman, is that concerning civil servants who joined after the year 2000, we don't think their quality is inferior in any way. So if the quality is the same, why is it that the benefits have disappeared? Is it that if the market is like this, you have to do the same? Is it that you must follow the market? Now you try and send an application letter to companies in the private sector, and do you think you can get a job which gives you over $200,000 a month? My answer is no. Mr. Teng Ka-piu. Yes, Chairman. I want to say that it's regrettable that the administration has not changed its position concerning providing Chinese medicine service. Now, we want at least a policy so that we can monitor the progress. But then we understand, we can see here that the doors are entirely closed. So you're saying that DHA does not operate any CMCs as part of its standard services. All right, I understand that you've chosen the wording very carefully. You don't want people to accuse you of being discriminatory against Chinese medicine. Tomorrow in the Manpower panel, we'll be discussing whether chiropractors will be allowed to issue sick leave certificates. And the Labour Department is telling us that there are only 120 chiropractors in Hong Kong, and the number of attendances is decreasing. This is understandable because chiropractors cannot issue sick leave certificates. No, right. In fact, many people like to receive Chinese medicine treatment. So for chiropractors, you're saying that they cannot be allowed to issue sick leave certificates because there aren't enough chiropractors, there aren't enough people seeing chiropractors. But then for Chinese medicine service, you are saying that they are not part of the HA's standard service. And then you're telling us that a Chinese medicine hospital will be set up, and then you're saying that perhaps you can carry out a review in the future. But what if in the future the Chinese medicine hospital is operated by a university? And then you again tell us that it's not part of the HA's standard service. So we hope that for civil servants who see Chinese medicine practitioners, they should be allowed to claim reimbursement of medical expenses. Or can you consider another alternative, and it is providing a Chinese medicine outpatient clinic?
先因為出病假咧就唔可以即係兩個直接比較啊，因為嗰個病假喺法例上就要求到。簡單嚟講，就算而家個私人西醫亦都可以俾病假，咁但係個問題就唔係話表示即係就係私人嗰個譬如嗰啲某啲嘅西醫嘅服務咧，都係包括喺呢個醫療即係政府嗰個俾公務員嗰個醫療福利裏邊。咁呢個有呢啲唔同嘅嚇。咁至於嗰個中醫嗰個醫院點樣發展咧？呢個我都一定要日後再同呢個食衞局方面了解佢哋嗰個發展係點樣。
The Food and Health Bureau. Of course, the government would also have to look at the overall development of Chinese medicine. So at the moment, I really cannot give you an answer. However, we understand our colleagues' aspirations, and I will relay their views to the Food and Health Bureau. How about the question I asked earlier now, that is, how about a Chinese medicine outpatient clinics for civil service? If you think the CMPs are not up to par, and if the Food and Health Bureau really decides to build a Chinese medicine hospital, will you then consider including Chinese medicine service in your benefits? Well, last year we also answered this question. The DH is not responsible for providing this kind of service, so they do not have a plan to set up a Chinese medicine clinic. Now, we will continue to monitor the development, and we will also have to look at our resources and capability. And if there is a change in services, over 500,000 people will be affected. So in terms of resources and manpower, we really have to be very careful. So actually, there is only one reason. You want to save money, you want to save on the welfare benefits expenditure. That's why you definitely will not include Chinese medicine. Well, no, that is not the case. Now, it is whether HA will turn this into a standard service, and later on we will continue to explore in this direction. I think you are discriminating against CMP. Madam Chair, I don't think so. So the first round of question has ended, and for the second round there are 3 members, me, Li Chut-yen, and Kwok Wai-keung. Each member will be given 3 minutes, and for the remaining time we can allow the deputations to ask questions. And we will have to reserve 10 minutes for Mr. CHEUNG so that he can tell us more about his motion, and then we will vote. Secretary, you already got a motion, right? I have a follow-up question. It's very simple. I would like to ask the Secretary, now for the HA, what kind of medical services does it provide to its staff? We are not too sure. So an employer would normally takes care of its staff. So can you give us the information? How about drugs? Dental service? Do they have their own clinics, and is the waiting time shorter? So can we get this information? Please provide us the information in writing. Yes, we will do that. Mr. Lee Chuk-yen? I would like to seek clarification. Secretary, you talked about $1 billion. What's that? For reimbursement, it's not $1 billion. You said that in 2009 it's a certain figure, and then now it's $1 billion. Secretary, for Mr. Lee's question, well, $1 billion is an example. Now we are giving money to DH to provide medical services to civil service eligible persons. For the estimates for 2014 to 2014 is $1 billion. So it's not about reimbursements. It includes outpatient service and what? For this $1 billion is funding for DH so that it can provide medical and dental services to civil servants and eligible persons. And that $1 billion covers families, clinic, dental services, as well as reimbursements of medical expenses, all inclusive. But it does not cover the extra expenses for HA, for specialist clinics and imaging centers. That's about $85 million. Now, for dental services, you used to rely on insurance, but you said it was too expensive, so that's why it's changed. So can you tell us how expensive it was and how come you put out? Madam Chair, well, it was many years ago. I do not have the details in hand. At that time, civil servants could visit private dentists and they can ask for reimbursement. But we discovered that it was very difficult to control the expenditure and quality of service. So it was a pilot scheme and it was not feasible, so we abolished it. As for details, I can provide them to you in writing afterwards, but that was many years ago. So you have tried that. For dental service, well, you have not answered the deputation's question. Now, you are saying that you will make improvements, but you have to wait for a long time. Now it's long over. They have to wait for a long time before they can get orthodontic or other dental treatments. Now we have increased resources in this area as well. Orthodontic service, the biggest problem is that we do not have many orthodontic specialists in Hong Kong. So even if we want to increase our services, there are a lot of restrictions. Second round of questions. The last one is Mr. CHEUNG. I have two questions. Paragraph 10 of the paper, you talked about Kowloon Families Clinic, and there will be 2 more. So when will we see this additional 2? And for NCSC staff, now because their posts not fixed, so that's why benefits cannot be given to them. But In June 2013, there are still 4,746 NCSC staff who have worked for over 5 years. And at least 22,000 of them have worked for over 10 years. So they have been working for a long time for the government. They are like normal civil servants, but you are not giving them civil service and political benefits. So it's just like the unscrupulous employers in the private sector. They are renewing their employees' contract year by year so that they do not have to give them benefits. I'll answer the second question first. Maybe Winnie can answer the first question. As I explained just now, for NCSC staff, well, their employment terms cannot be mentioned in one breath with those of the civil servants. When we recruited them, we already told them what kind of benefits they would be able to enjoy. So they knew that the terms and conditions were different from older civil servants, and these benefits cannot be compared directly. As for figures, maybe my colleague can answer that question. Well, the 2 consultation rooms at Kowloon Family Clinics that are not open yet. DH hopes to open them as soon as possible. It depends on whether we can recruit appropriate healthcare staff, but we will do it as soon as possible. Does it mean within this year? Our goal is within this year. Only 1 month remains. We are not talking about the fiscal year of 2013-14. We're talking about the whole year of 2014. So now we end the second round of questions. I'll give 10 minutes to the deputations. Dr. Yun, please raise your hands first. Mr. Yun, well, many representatives would like to speak. Mr. Chen, 2 minutes each. Please put the names down. My clerk is doing something else, so please raise your hands again. Mr. Chen, Ms. Lee, Mr. Kong, Mr. Chong. Yes, we have seen your hands. Okay, Dr. Yun raised his hand first, 2 minutes. So you ask all your questions in one go, and then the government will answer. Now, for the Secretary's answer, I was not pretty happy. He said that for elderly services is not provided by the HA, so that's why it's not provided. For CSR 9,000, I would like to quote from it. So for this kind of benefits, they are to be provided by the HA and the HA, not DH. So if SWD is a government department, then elderly services will be included. As for the private dentist service, from 81 to 83, I have audit reports of the relevant years. It says that for this scheme, it should be regarded as successful because many civil servants made use of this scheme and received treatments that could not be provided by the DH. But there were some issues. It said that there were certain non-compliance or misunderstanding of the rules of the scheme.
A few dentists 明顯地咧，佢指出當年個 audit.
So the audit reports said that when it comes to monitoring and details, they were not very clear, but they were not the problems of the scheme itself. It was the problem of the administrative ability of the CSB, and that's why the scheme was abolished. Now, if the CSB is more efficient now, why can't this scheme be reinstated? Now, there are many private companies that are making use of the services provided by private dentists. So for private companies, they have the administrative ability to do that. How come CSB does not? Ms. Chuck, a point of clarification. Just now, Mr. Tang says for NCSC staff. Well, actually, they are full-time staff. They are not part-time staff. As a good employer, you should treat the NCSC equally. They should be provided with basic free medical benefits. Now, the population is increasing, and the government is not providing enough healthcare services to the public. This problem is getting more and more serious, and the Chinese Civil Servants Association is very dissatisfied with the government's performance in this area. Yes, we want to reiterate that we hope the CSB can review the retirement arrangements for civil service that join the service after the year 2000. That is, they should be entitled to medical benefits. And for families clinics, I understand that NT West, they have a clinic, and in Fanling, they are going to set up another one. So something has been done, but is that enough? Even though many more families clinics are built, there are still not enough places for civil servants and eligible persons. There is still a huge gap. So we want to suggest this. There are hundreds of thousands of civil servants and eligible persons. So that's why we suggest that a civil service hospital should be built. We want to give the public a clear message. We are not fighting with them for healthcare resources. The government is our employer, and we want our employer to treat us in a better manner.
Yes, Mr. Chen Cho-kwang. Chairman, we do not agree with the Secretary that it is not possible to calculate the cost for providing medical care to civil servants. That because when civil servants go to a clinic, or when civil servants pay the bill and they are discharged from hospital, it is known immediately that these are civil servant patients. In fact, we've looked at the benefits provided by private sector companies, and they're spending about $8,000 per annum on each employee, and the civil and the staff can go to any doctor in the private sector to get treatment. But then for civil servants, they must not feel unwell after 2:30 p.m. And then it's very difficult for those in the discipline services, including those working in the police force, to see doctors because we have to work shifts. We think that trying to resolve the service shortage problem by medical insurance can help improve upon the situation and can also help promote the development of the insurance sector. So we hope that there can be more contracting out, and medical insurance should be used to help solve the problem. Yes, Chairman. This item is called an overview of medical and dental benefits for civil servants, pensioners, and eligible dependents. But I think members may get the impression that we are now begging the government for more services. Now, when the hospital authority was set up, the government decided to hand over the service for civil servants to the HA. Was the move motivated by the desire to reduce costs? These are benefits that we are entitled to. So is it that we are making excessive, unreasonable demands in asking for Chinese medicine service? Why is it that for specialist service, the queues are getting longer and longer? Now, I think all these problems are caused by the shortage of medical healthcare personnel. Mr. Cheung. Now, I've been a civil servant for over 30 years, and I can tell you that I have never enjoyed the best medical service. And in fact, the worst period was from 2004 to 2009. We are not really asking for more. We just want the previous level of service to be restored, and that level of service was not the best service. And then the Bureau said that there were still surplus priority discs. And I said many times that the government must not cite the attendance figures for clinics in Sha Tau Kok or Tai O. I think members to understand the situation. And also, each term of government lasts for 5 years. And maybe it's very difficult to have a government with a far vision and commitment. In fact, 2 years ago, our union suggested that the retirement age of civil servants should be put back. And then it was said that there was no room to consider such a suggestion. And now, this term of government is saying that it's considering the matter quite urgently. Now, in fact, for civil servants who joined after mid-2000, they do not enjoy any medical benefits upon retirement. But then at the moment, pensionable civil servants represent a majority. We are telling the government that this is a time bomb. Please do not think that we can brush this aside because we're talking about many years down the road. You know, as time progresses, the non-pensionable civil servants will form the majority, and this time bomb will explode sooner or later. Right, Mr. Lam, do you have anything to add? Chairman, in fact, the secretary gave you the figure. $1 billion. So, in fact, they are fully capable of coming up with the figures. And I don't believe that it's so difficult to work out separate accounts or separate figures for resources used from civil servants. All right? So I will now allow the secretary 5 minutes to respond. And then we'll have to deal with the motion. And I understand that Mr. Tan Ka Piu would like to propose an amendment. So we've issued the amended motion, the wording of the amended motion to members. Now, in fact, the adjourning time should be 12:45, and I'm afraid we have to extend the meeting by 10 minutes. Thank you, Chairman, and I thank my colleagues for their further comments. I want to say that we, according to the contract, we provide free medical and dental services, and these do not include care and attention service. Then it's difficult to directly compare the government with the private sector. Now, no private company needs to show the responsibility to provide dental services for so many people. So private companies can allow their employees to receive dental service under the medical insurance arrangement. But then for us, we'll continue to try to increase the number of dental surgeries. And And I think, and also for NCSC staff, we've discussed this issue on many occasions, and I don't think their benefits can be compared directly with those enjoyed by civil servants. And then as to whether we're going to build a hospital for civil servants, I am sure there will be great difficulty. Next, the HA provides outpatient service and surgical services for civil servants and eligible persons. And then for employees of in the private sector, they may be given a maximum amount every year, but then maybe comprehensive service cannot be provided, and the HA finds it difficult to separate the figures relevant to civil servants, and we also doubt whether it's meaningful to do so. Then for civil servants joining after mid-2000, I think our primary concern is whether we will still be able to attract quality staff, and our experience in the past decade or so tells us that we are still able to do so. All right, due to time constraint, I think we'll have to deal with Mr. Kwok's motion. Mr. Tan Ka-pew has proposed some amendments. Mr. Kwok, can you, I'll give you 5 minutes so that you can read out your motion or explain your motion to members. Yes, Chairman, thank you. I think my motion summarizes the views expressed by the deputations and members. This panel urges the administration to honor its pledge and provide reasonable medical services to civil servants, including the following: A, upgrading the quality of existing medical services; B, immediately review, carry out review on the inclusion of Chinese medicine service into civil service medical benefits. And then third, for non-civil for NCSC staff serving in the government, they should be given medical benefits on par with those enjoyed by civil service. Mr. Tang, not just I'm just trying to elaborate on A. I have suggested adding these words, including increasing families, clinics, and shortening the waiting time for specialist service. And then under B, I've added the following: considering the provision of certain Chinese medicine service in families, clinics. Members, what are your views? Ms. Emily Lau. Chairman, the SAR government should provide favorable terms of employment to attract and retain quality staff, and I believe this is also the wish of the general public. I think the deputations have made reasonable requests. The secretary said that the requests made were overgenerous, and I'm sure the public will not accept overgenerous requests, but then the secretary quickly corrected himself. Anyway, the public also wants civil servants to enjoy favorable terms of employment, and then they can serve the public. But then, you know, the public are also fighting very hard for these reasonable services. So yes, you are representatives of the unions. You are fighting for these interests of your members. We can understand, but we hope that you understand that in fact these requests on your part are reasonable, and there are also similar requests from members of the public, and these are equally reasonable. These are not over-generous or excessive demands or requests. And we're going to the UN hearing in May. We hope that the Secretary can respond to the demands of civil servants and the demands of the general public. Medical services are basic services. In this forum, we are not talking about the medical services of all members of the public. We are only talking about the services for civil servants. The SAR government should make use of its wisdom to try to resolve this problem faced by civil servants as well as by members of the public at large. Secretary? Now, concerning Chinese medicine service, we've already explained that we will try to provide the service, or we'll try to look at whether the development of Chinese medicine in the public sector. And then concerning our policy for those who join after mid-2000, the primary concern is whether we are able to attract and retain quality staff.
If there are no other comments, then let us vote now. Let us first vote on Mr. Tang Ka-piu's amended motion. For those who support this motion, please raise your hands. Please raise your hands again. Mr. Lee, you also agree? Okay, or say yes, no objection. And how about Mr. Wai Kang's motion after amendment? For those who support, please raise your hands. Okay, unanimously you agree to the amended motion. Thank you. So we have discussed all the items on our agenda. I would like to thank the deputations for attending the meeting. You may leave now. Agenda item 6A or B. Any other business, members? If not, we will adjourn the meeting. Thank you.